Hi, everyone. Welcome. We're glad that you all could join us today for the next webinar in our Network Commons series, Shifting Power to Communities Through the Use of Community-Driven Data. As you can see, I'm not Kevin Leacock, the program manager at Build Healthy Places Network, who is planning to moderate this session. Unfortunately, he's out sick today, so I'm stepping in. My name is Colleen Flynn, and I'm the co-executive director at Build Healthy Places Network. And I'm coming from you today from Asheville, North Carolina. As I continue on with a quick introduction on our work, please feel free to type your name, institutional affiliation, and location into the chat. We want to see where everyone's coming from. But first, a little bit about Build Healthy Places Network, for those who are unfamiliar with our work, and for those who are familiar, just a little bit of a reminder. We are a national center that aims to advance collaboration between public health, healthcare, and community development with the aim of accelerating community-centered investments in racial equity and health equity. We are a program of the Public Health Institute, and with funding from Kresge Foundation and the W.K. Kellogg Foundation, Build Healthy Places Network launched Community Innovations for Racial Equity to support BIPOC-led community development corporations in their efforts to build internal capacity, community power, exploring innovative community ownership models, and addressing the barriers and gaps within community development and healthcare partnerships. And community innovations for racial equity cohort there's a cohort element, and it's designed to be a safe place that allows leaders of BIPOC-led community development corporations to connect and validate each other's experiences and challenges with their work. And for those on the call that aren't familiar with community development corporations, I'll give a really brief concept of what they are. They're nonprofit organizations that were born out of the civil rights movement to build healthier communities in disinvested neighborhoods. They work on improving social, health, and economic conditions. A lot of them build affordable housing community centers, a lot of bricks and mortar work, and then a lot of them also provide social services and supports and advocacy. And we actually have two individuals from the cohort joining us today for this conversation, so I'm really excited about that. I'm also really excited that we have such a thoughtful panel discussion here for you today, and we can just get to it, I think. My introductions will be brief. We will put the full bios in the chat so you can get a little bit more information about the panelists. And panelists, if you could give a quick wave when you're introduced, that would be really, really helpful. First, I'd like to introduce Brody Wombley. He is the Community Affairs Officer at Power Center Community Development Corporation. Brody is a community and business development professional with an emphasis on building stronger communities through education and sharing resources. Now we also have Brandon Walker, who's from the Lower Ninth Ward Main Street Coordinator at Sankofa Community Development Corporation. Brandon works towards bringing economic vitality and infrastructure redevelopment to a corridor in New Orleans in the North Ward of New Orleans. Last but not least, we have Vidette Gavin, founder and principal at Verge Impact Partners. Vidette has committed her career to cultivating the research, strategy, and leadership in communities and institutions to create conditions where people and communities of color are well and thriving. Thank you all for coming again. We are really excited to have you join us here today, and thanks for all who are watching online. Before we get into the discussion, some quick housekeeping. I know most of you are very familiar with Zoom, but just a quick reminder, please use the Q&A function to suggest questions for our speakers and panelists, and use a chat function for any difficulty you're having with technical challenges that we can troubleshoot. Okay, now let's get into the discussion. I'd like to open up today's discussion by first asking our Community Innovations for Racial Equity cohort members, Brody and Brandon, each to talk a little bit about the importance of data collection and evaluation in advancing racial equity in your community development work. Why is it important for communities to lead in the collection process and ownership and application of a data evaluation to advance racial equity? Do you see this as a way to shift power to communities Brandon, let's start with you.
Sure. Good morning, everyone. So it's important to have that collection process and evaluation because it get not only does it identify, those shortfalls within the community, it also gives a sense of ownership to the community that they are part of the process for bringing that change.
Thanks, Brandon. Brody, let's go to you. Can you talk a little bit as well about, same question, how important is community-driven data collection, evaluation to the work for Power Center CDC? And how do you see this as a way to shift power to communities you engage with in Memphis?
Thank you. And I agree with Brandon. We really do need the community's input to solve those issues. I, as a board member of the Power Center CDC, I have my own viewpoint, my own perspective, but it may be different from somebody that's actually in that community. So it's important to hear their input, their situation, so that as we move forward in trying to find solutions, we're actually attacking the issue at hand versus what we think is best for them.
Thanks, Brody. Okay, now let's move on. Vidette, with your background in helping to guide community-driven and community-owned data solutions, I think it's important to bring you in here. In our conversations, you've mentioned two things consistently. One, that there is no right way to do racial equity evaluation. And two, it is not enough to primarily focus on the disparities in marginalized communities when looking for a solution. Can you elaborate more on these ideas and any thoughts on how community development corporations and other community-based organizations on the call can use what assets they already have to get what they need, which might mean coming up with their own ideas for evaluation and finding out what is meaningful to them? Vidette?
Hi, everybody. And thanks for that question, Colleen. I think, yeah, saying there is no one right way, right, to do racial equity evaluation, just from work with communities and colleagues over the years, we do racial equity evaluation because we want to prove or show how the work that we're doing is actually contributing toward more racially just outcomes in the world, right? And that, as Brandon and Brody say, could be about, putting different people in the leadership role, validating and legitimizing expertise, leadership, voice, power, positionality of community. That can be about removing barriers to inclusion and access for groups of people, which is a different kind of proof point, right? So it could be around something like, improving access to green spaces, which, requires a different proof point when you're thinking about evaluations and saying communities know what they need. And when you allow them to control resources and design a solution, you get something that multi-solves. Maybe you want to prove that in your evaluation. Your evaluation could also be about making systems level shifts and interventions that make systems more consistent in producing equitable outcomes. And that's a different type of evaluation. So I guess when I'm saying there's no one right way, right? When people come and say, I want to do a racial equity evaluation, that could be an assessment of people, that could be an assessment of systems, that could be a demonstration that distributional gaps are closing, that could be a power analysis. So it's not enough to just say, oh, if I'm going to do a racial equity evaluation, I'm going to stratify data by race. And so it's a racial equity evaluation. I'm going to do a racial equity evaluation. And I'm going to engage 25 community members in a community advisory board. And so now it's a racial equity evaluation, right? It really is about understanding how the work itself, the organization, the people, the strategy, the theory of change is making a contribution to more racially just outcomes in the world and demonstrating that through your data. And so that could mean using both qualitative and quantitative data. That could mean a participatory design. That could mean a different type of geospatial analysis that maps interlocking systems with population level data. But it really has to be about understanding that contribution to racial equity, right? It's not just, principles for data science, principles for community engagement. I follow this formula. I am now doing racial equity evaluation. And I think on top of that, like Brody and Brandon kind of drove in, we need community voice for that because we want to measure things that actually reflect the way communities see systems impacting them.
Fantastic. All three of you, really appreciate your responses to questions. So I'm going to open it up to each panelist to talk a little bit about in what ways have you worked with neighborhood residents to design strategies to collect data, to identify what is important and meaningful to them? Did you experience any implementation challenges? If so, how did you solve for that? How do you choose what metrics to measure and why? And feel free to talk a little bit about your organization as background if that's helpful. So if anyone would like to start, or I can call on somebody, but just in what ways have you used design strategies for data collection, challenges, help you solve for that?
I can start this off. So a big aspect for our organization is using the knowledge of the people that are in the community. We have elders within the community that's been there since before Katrina. They know the best ways to communicate with their neighbors. They know the best way they like to be communicated with. They know who lives in the neighborhood. That's how we get our message out, because we talk to those elders who talk to those other community members in regards to the ways that we, let's see, how the challenge though is those elders only have certain ways that they can communicate. They're not within like the younger millennial Gen Z generations that grew up with technology, phones, texts, internet, things like that. They have more traditional methods of talking or communicating, which in and of itself can be a challenge, but also can be a blessing because they see the passion that our organization has in regards to wanting to bring change within the community.
Thanks, Brandon. Brody, do you want to talk next?
Sure. Power Center CDC is located in Memphis, the Hickory Hill area of Memphis, Tennessee. And two projects that we're proud to hang our hats on are, one is a 16 single family residence community that we built, as well as schools, elementary through high school, as well as a performing arts center. And we could not have done those efforts without the community's input. It would have been easy to just move into buy up a plot of land and just stick some houses up there and say, good luck. However, out of those 16 houses, we had some of those homeowners on our board to give us their feedback and input that they need as residents versus us deciding what's needed, what's best for them. In addition, we work hand in hand with our school board here locally and the charter school network to get the best of the best schools that we could for our community. So in a sense, we're providing affordable housing, financial education, formal education, and we needed those people that are in those communities to give us their feedback in order to make a difference in those areas. So it's vital to have your community stakeholders involved, and not just the residents, but it also included our business owners, our school boards, our local council, say our county commissioners and our city representatives. It took everybody to put this together, and that's one thing that we're proud of as a result.
Thanks, Brody. Vidette, do you have anything you'd like to add?
Yeah, I think I can add on. I think a different and meaningful experience in our work is that we often are working with communities on the evaluation or data collection side when they're looking at kind of like broader neighborhood level systems, right? So wanting to make the case for an opportunity that's needed, a zoning reform, a way of working. And I think one of the strategies we've used that's really helpful is asking community members to develop their own theory of change around how these things should be working. And then, like Brandon and Brody are saying, pick the measures that they think represent success for that. So asking things like, if transportation in this neighborhood were to enable you to fulfill your life priorities, what would a day in your life look like? You would wake up in the morning, your family would be able to do what, you'd be able to go where, how would that function, blah, blah, blah. Turn those experiences into a theory of change and then say, okay, so, if a transportation system was structured like this, then these possibilities would exist in the community. What would success look like? How would we know if we got there? And how would we know if we're failing at it? And I think to your question about what challenges do we experience in that, it's making the explicit choice to prioritize those measures over traditional systems indicators that funders often want to see. Or to be able to compare the data that we collected to kind of the regional transportation data, which is not going to talk to you about the number of, barriers or delays you might have in your day, getting your child to daycare and then getting yourself to work, and the impact that has on your stress, right? But their story and their measures often are integrated to show the compounding and interlocking ways that system would affect them. And so it's, a challenge in making that choice, but we often overcome that challenge because that data is much more useful to community members and organizations on the ground, and they're able to act on it much more quickly than saying the transfer time between this stop and this stop is X. That doesn't really enable you to show a difference or a change in quality of life or stress. But when we kind of measure the things that communities have prioritized, we see a result. We see that data getting applied, and prioritizing that in the short term is kind of risky, but in the long term, we've seen much greater returns. So
that's really helpful for that. I wonder if you would be up for talking just a moment about the Healthy Neighbors Equity Fund and the study that was done there, and just how that might apply to this work around community-driven data.
Yeah, sure. Thanks for the invitation to share that. So a concrete example of this is in Boston, where kind of we work with communities in the greater Boston region. There was a housing investment development fund that was, trying to aggregate and deploy funds to support the type of healthy and equitable development that a lot of communities were wanting, but could not, operationally attract through the deal structure, right? And one of the questions is, on the surface, this fund was trying to develop, housing with healthy features, but they wanted to understand, like, is this housing actually making people healthier? And for example, the indicators that we had to choose from for is this housing actually making people healthier is like incidences of cancer, incidences of diabetes, incidences of asthma. But what people were really wanting to understand is like opportunity, financial security, connectivity, economic mobility for families generationally, right? So there wasn't, when we did the theory of change of, well, what would successful investment look like? It did not include indicators of disease. Like nobody was like, what it would be. That's important to systems, but for people living there and organizing and trying to get resident support for those developments, it was like, will my grandchild be able to afford to live in this neighborhood? Like something that was generational, and those indicators looked a bit different. So we then created the Healthy Neighborhood Study, which is all about community-derived indicators for success, for what a healthy and thriving neighborhood would look like through the resident experience. And we were able to collect that data year after year after year, so that now systems can use that data too, because we've structured it kind of in a longitudinal format and across all communities, so that they can mine that data. And you can check out that project at hns.mit.edu.
Thank you, Vidette. It was really helpful. And we also have a community close-up on the fund that my colleague just put in the chat function as well. Brandon, maybe this is a good question for you. So if you're not in a big city like Boston, or in areas where there's disinvestment, maybe some rural areas, what about these places where there's digital infrastructure may not be that strong? How do we make sure to include their voices in our data and evaluation work for people that live in areas where their digital infrastructure might not be as strong?
Well, as simply as I could put it, you got to put boots to ground. Sometimes when you don't have that infrastructure where you can have a solid CRM where you can do mailers or call people or things like that, sometimes you got to go out into the community and talk to them. And honestly, that's one of the best methods to get that honest opinion, that honest data, because they know that if you're going out there to talk to them, one, they're going to think you're annoying a little bit, but also they're going to see that you care enough about what you're trying to get that you want to talk to them face to face, especially when you don't have that digital infrastructure.
Anyone want to add anything about the digital infrastructure or the lack thereof for thinking about data collection and processes with communities? Okay, I'll move on to the next question. So let's shift a little bit to accountability. In our Community Innovations for Racial Equity cohort that we've been talking about, a lot of the sessions we've talked specifically about ways to hold institutions accountable, like healthcare, since that's one of the sectors that we work with, around their racial equity commitments. So how do you see data and evaluation playing into the role of storytelling, creating pressure, shifting the narrative so communities' needs are prioritized before institutions' needs? Vidette, let's start with you.
Yeah, I think, you know, again, going back to asking questions and choosing measures that enable communities to take a next step is a really focal point for us, right? So a lot of times the imperative for data collection is proof that you are doing what you said you would do so you can get more money, which is important. But also choosing to say, well, how will the asking and answering of this question increase a community's power, capacity, capability to do the thing that they set out to do anyway? And irrespective of, you know, what the funding imperative may be for measurement, has been something that we've constantly tried to prioritize. And it's not like a binary trade-off. It doesn't mean if you ask this, you can't also ask that, but making sure that every opportunity we have to formulate a question, determine how to measure it, determine how to collect the data, we think about who's benefiting from the act of doing this and how can we make sure that community benefits from that. It is like a really important kind of tactic or approach or principle that we kind of continue to use. And I also think, you know, Brandon and Brody said this earlier too, like validating the expertise of people who live there, like thinking about not just data sources, but kind of like cultural information, experiential information versus mainstream information, and choosing in our analysis and our research to put on par community knowledge or to prioritize community derived knowledge ahead of mainstream knowledge, and just making those, understanding that those are choices that we can make and do make each time we gather information, have been really important, I think, in our work.
Thank you, Vidette. Brandon, what would you add to that question?
I would add that getting that solid data really, at least for our organization, helps us counter the narrative of what is perceived about the community. You know, we are nested within the lower ninth ward of Louisiana. The common narrative that if you didn't live here would be, you know, it's, you know, crime, you know, just waste or trash everywhere, which is not true. So getting that solid data, making sure that we can counter anything that, you know, either outside influences or common knowledge that, you know, they try to throw at us, to make sure that we can't either get funding, if we can't get, you know, people to come and, you know, be residents there. When we have that data, we can, you know, fight those narratives, be like, hey, no, this is not us. Our community is thriving. Our community is doing, you know, so much positive things that there's no reason for this narrative to come. And we are continuously using data to counter that.
Thank you, Brandon. Brody, let's bring you into the conversation, into this question.
All right. Well, from my viewpoint, it's about actually believing the data, because there's some statements that are just blatant statements that may hold true for the general public, but when you narrow it down to our community, it's completely different. Like there's the assumption that everybody that owns a home is on their way to building generational wealth, but not all the time, especially in our low and moderate income neighborhoods. Our property values aren't increasing like the other ones. Um, Especially if you're in an area where it's heavily investor, where there's more investors than there are homeowners, those numbers are skewed and it looks as if the population may be gaining wealth, but it's actually those investors versus the actual homeowners. So it's a matter of whether the data is true. And to Vedette's point, what are you really trying to find out? Are you asking the question just to get a specific answer, or are you looking for truth? So it's really about believing the facts and finding out what the intention of the data is.
It's a great answer, Birdie. And I heard you say truth, and it leads me to my next question, actually. And what about things that might feel difficult to measure that the community might really want to measure, like power and hope? How do we include that into our racial equity data and evaluation processes, and why is it important to do so? Vedette, maybe we could start with you on this question.
This is a loaded one. I was actually, Brody, go again. I want to hear what you're going to say on this. I mean, I think that hard truth, man. Experientially, those things are hard to measure for institutional actors. You ask any mom on the street, like, what does hope look like and how would I know it when I see it? They're going to tell you how you know it when you see it. What does hope look like at a community level? What does power look like at a community level? People kind of understand what things look like. They can say what it means. They can say, I can point to an example. This block, I can tell there's a lot of hope because XYZ, this event happened, this, da, da, da. The real thing is like what Brody said, like the power differential and making the data believable. The thing we find a lot of times is even if we measure it, institutional actors will say, well, that's anecdotal. Where's the evidence that is how you measure hope singularly, right? And so I think it really is about understanding who your audience is for the data and making the case, telling the right story, and challenging the power imbalances that say we don't know how to measure these things reliably. That's the thing, reliably or credibly, because communities already know. And so I think one of the tactics that we've taken, kind of sometimes we fail to use the power of the existing kind of database, communities, indigenous folks, Black folks, organizers for decades have been, doing this work, doing this research. There's a million models and ways and survey questions to measure hope, right? We just don't always know they're out there. So one of the tactics that we've used is kind of saying, there's 4 different ways that folks have measured hope over the last, 2 decades. And so, the way we're measuring hope kind of aligns with that or builds on that, right? And so those examples are out there. They're just typically not connected to conversations about housing or health, right? They're kind of more in the organizing and self-determination fields and things like that, and education even, but they exist.
Thanks, Vedette. Well, let's bring Birdie into the conversation and question, as Vedette was suggesting.
Okay. Well, just so the audience knows that I am a full-time banker. I just serve on the board of the Power Center as vice president. And in my role, my former role, I was a mortgage loan originator. And the lack of hope is the main thing that disqualified people from becoming homeowners. It wasn't that they didn't qualify, it's just that they didn't believe that they could. So before they would even approach me, they would say, I can't do it. I've got bad credit, or I've got this and that. But to me, I'm like, well, that's manageable. We can handle that. So it's a matter of getting the education out there, dispelling rumors and myths, and actually creating hope. Share those narratives of people that have success stories. Those underdog stories where somebody just kind of ruled themselves out, put them in the forefront as far as being an example of what can be versus all the negative stuff that we hear in the press. So it is difficult to measure hope, but I can definitely tell you what discouragement looks like. And it's heartbreaking.
Thanks for that. And Brandon, yeah, same question to you. Just, what about things that are difficult to measure? As we're talking about hope and power, how do you include that in evaluation processes, and why do you think it's important?
At least from my perspective, quantitatively, it's very hard. Qualitatively, however, it's very helpful to get those type of aspects into your studies because it's something that you can measure against that quantitative data sets. For example, people can want to have a grocery store. They want to hope that they have one, that they see potential within their community. But if the data doesn't support that as well, where you may survey, 50 people within the community, it's like, well, I mean, I could just go to Walmart down the street. That gives, at least for me, that gives me the notion of what is Walmart servicing, or what do they offer that still makes people want to go there, even though they want a grocery store within their community. It makes me want to look deeper into the issue. So it's not necessarily, putting those type of aspects such as hope, potential, despair, things like that, putting it to the side. It's using those type of aspects to kind of look at critically what the quantitative data that you have.
I love that concept of really looking critically at the quantitative data and thinking a lot about qualitative data that you can bring into an evaluation and a processes. So thank you for that. I think those are all the questions that I had for the panelists, but we had many questions that have come in from the folks that are listening. And so I'm going to share some of those. The first one that I'd love to share is just thinking about how we can prevent community blowback in providing data. Our data seems to fuel the antitrust groups and not increase engagement. Brody, do you want to take a first stab at that one?
Sure. And I kind of feel like I'm echoing, but it's important to get all the players' input in regards to the questioning, because sometimes you don't know what you don't know. So it's good to get input and perspectives from everybody across the table, from the residents to local government to CDCs of all ages, all races. It's good to get a collection of data from all different viewpoints and perspectives versus just making assumptions. So the way that you prevent blowback is through inclusivity and by bringing people to the table and everybody having a voice.
Great answer. And anyone else want to try to answer that one about thinking about blowback when providing data and how to handle that if it doesn't increase engagement, actually decreases, it sounds like in some cases?
I think something that gets lost when we're talking about like facing that potential blowback is ensuring that we as organizations understand what that data means. That and those second, third, and fourth order effects of what that data entails. If we as organizations fully understand what that data means and what that data can be used for, then we can address those type of blowbacks or those type of questions from the antitrust groups. It's like, oh, well, why is it going like this? We can answer intelligently, we can answer calmly, and it's not a argument. It's more addressing what they're trying to get at.
Thanks, Brandon. And Vedette, do you have anything to add to that question?
I mean, I think Elizabeth in the chat just got at, kind of, I think a point all three of us, definitely agree with, like, and at the foundation, community should own their data, and be involved in the process. So I would think about, like, who is connected to this data, and like Brandon said, like who, kind of validates it, who's connected to it, who speaks to it, who created it. When communities understand where data came from and there's transparency in that, who's in control of it, what they're doing with it, whether that's them or someone else, right? That enables kind of communities to know what is happening with it or decide what is happening with it. A really concrete example for us was that, we studied the topic of land use and gentrification, and our municipal maps kind of already show the neighborhoods redrawn under new boundaries that basically appropriate Black space and turn them into new cool white spaces that no one wants on the ground, right? And so, like, even being able to go in and say, like, okay, like, we're going to like redefine these boundaries, like, who did this? This is actually a community derived data set that actually shows the boundaries as they exist now. and not what we're trying to push them toward, and then redo that data, kind of like people know like where that data came from, who owns it, and what can be done with it. So I just think, thank you, Elizabeth, for putting that in the chat.
Thanks for that. Here's another interesting question about the role of government. Just says a lot of community data our organization collects and works with is qualitative, lived experience, generational stories, survey results. What tactics have you used to get government institutions to recognize the validity of this qualitative community data and start incorporating it into their decision making? So if you have any experience trying to get government institutions to recognize that validity, or if you haven't, maybe some suggestions on strategies you might incorporate.
I know one thing that really helped for us is inviting those governmental leaders to come to the community, to look the people in the face, to hear their stories. Because it's one thing to get an email about, our community members are very against or for or want something. But when a councilman, when a governor, when a mayor, when a leader comes to those communities and see those faces, to hear their voices, it does one thing. It makes sure that they can't ignore what is being said. So I think that's one tactic that can be implemented by organizations at any level to invite those leaders that you are trying to get in touch with, trying to get into your network of change to make something happen.
100%. I agree with you completely, Brandon. I think another expression of that in our world, I'm an organizer first, researcher second, is like recognizing that, Brandon talked about inviting your institutional or your elected officials, but also recognizing like the government are people. Like the planning department is people, the health department is people, the education board is people, right? And like it's a group of people doing work. And so taking an organizer's approach to find who are those allies that are working in that department that keep running against the wall saying we should be having community voice, and they're the lone wolf. There is two of them in there that are like, this process should be different, but I don't have any support from community. So like building your networks and taking that time to explore who those folks are. When I'm looking at the check-in here of who's in this room, there's so many people who work for government, like in this webinar. So it's like not like when we leave our analysis of like institutions at departmental names and we remove their faces the same way institutions can remove community faces, then we miss an opportunity to organize. And really build on the power of the people who are there. So I agree with you 100%, relationship building.
And to piggyback, we kind of have to show them the data that they're giving us. If you see that there's a huge increase in dialysis centers, in check cashing centers, people going to liquor stores and pawn shops to get their checks cashed, that should show that there's an emphasis needed or that there's a need needed elsewhere. People want banks. People want healthy, grocery stores where they can get healthy foods. They would rather have gyms than to be on dialysis. There's different things that can come out of that data that I don't think a lot of the government officials recognize. Of course, they're throwing the stats at us, but are they really looking at their efforts and the results of them?
Pretty great answer. It makes me think of another question that someone asked about institutions and their role. So the question is, I appreciate the evolving paradigm shift toward funding community members for their time, insight to gather data from the community. How do we encourage or incentivize funders like CDFI, like community development, financial institutions, hospital systems, local foundations to support this important work? So how can we help incentivize those types of institutions to support community-driven data?
The best thing to show or to get those type of funding in is to show results, to show that you are using that data to enact change, because it builds the trust in those organizations that you are moving forward, and it shows that you can accomplish something. So, for example, for our organization, we we have an area in the Lower Ninth Ward called the Wetland Park and Nature Trail, started in 2015. And it was a strip of land that we took on, and we started the process of fully renovating it so it can actually be a ecological space for the community to come in to, bring their kids to play, fish, things like that. And the way that we got funders was we ensured that we had a plan, that we knew the process of renovating and landscaping the area, and that we were working with other organizations that were like-minded with us. And once funders saw that and we could show results, they are more inclined to give us more funding or to recommend us to other organizations who are doing that type of work, who want to fund those type of things. So to me, one of the best ways to go that route is to show that you can bring results.
Great answer about bringing results. I want to open it up to Vidette or Brody to also think about how can you incentivize funders to support community-driven data practices and strategies?
Two things. I would emphasize the opportunity lost by not engaging with groups like ours versus what's in it for me. What happens if you don't? Kind of have the consequences out there as well. Another thing, just slipped my mind. Well, I guess maybe circle back. I just lost my thought.
Vidette, we'll let you come on in.
I feel like I'm gonna just keep saying yes, what they said. Exactly what they said. I think Brandon, your point about showing results, and then Brody about like the price of not doing so. I think one important thing, at least for philanthropic funders, is like they always want to know like sustainability, but not for this dollars. Like, how are you going to continue? And like the most unlimited and untapped like source of potential and power and resource we have is people. There are thousands of community members in every neighborhood. And so making the choice to invest in them as, architects of the work, collectors of data, analyzers of data, public stewards of data, users of data is a more sustainable, useful, long-term, powerful investment. And then I think the other thing, Brandon, showing results 100%. Just a practical example of like where we've had to do this to unlock millions of dollars is I first started a community planning process in Cleveland, and they had like no data for 3 small neighborhoods, like no real data. And they didn't have money to pay residents or to pay for a community engaged process because the people who wrote the project grant were not thinking about it like that. But we had a $50,000 mailing budget because they had planned in the project to send survey mailers to every home 3 times during the 3-year period. Not that that's a bad thing, but $50,000 can buy a lot of people power, right? And by asking, engaging young people to go door to door and ask 10 questions that had to do with things that people were already working on, that would give them the data they needed to push their project over the finish line, like Brandon is saying, showing results, that led to 8 years of funding totaling up to $22 million. Like that high level of engagement, that turnout, being able to show we had over 20,000 residents engaged over that 8-year period because we did the organizing to touch them. So I think it's like building on everything they said, like, why would you not? For sustainability, for scale, why would you not? How could you not? And then like showing results.
Very good. I remember that thought now.
Great.
It's in regards to people in the same space. Instead of us all trying to, Memphis is known as a silo city. Everybody wants to work in their own little silos and do their own thing. But there's more, you get more results or better results through collaboration. A lot of us nonprofits are all fighting for the same grant dollars, the same, little nuggets of money here and there. But if we pool our resources, kind of take our name tags off and just work towards the effort, that makes a bigger difference than working individually. So
it's a great segue into the next question, thinking about working individually versus working collectively. And one thing you need for that is trust. There's a couple of questions about trust that I'm going to ask. One is that what are some strategies to build trust between data collectors and community members, leaders, especially when collecting data in communities that are untrusting, especially when that trust was lost due to systematic historical harms? Love to hear responses to that question.
So this question kind of hits hard with me. So as everybody know, New Orleans has been one of those type of cities that's been hit hard multiple times in regards to natural disasters and things like that. And a lot of organizations would come into these communities and they would ask for this data because they would want to connect this data to to systemic change that just didn't come. And once you do these type of things over a 20-year period, it erodes the trust of the community to anybody who wants to implement change, but they need that kind of those data points. So one of the ways that we build trust is true honesty and ensuring that whatever data that they're getting is going towards something, and we can show that that data is going towards something. And once they see that their input is actually part of the change that is happening within their community, then they're more trusting to give more information. They're more trusting to do surveys. They're more willing to come to community meetings to see what you're trying to do. So it's not an easy question. It is a hard process. And it starts with just being honest.
Yeah, that idea of being honest and building relationships to build that trust. Yes, that's great. Vidette or Brody, what would you add to that question around trust?
I mean, I think to build trust, we have to be trustworthy, and part of that includes acknowledging and validating that people have reasons not to trust, right? Like, I think with every opportunity that we touch community to create data, to use data, to evaluate, there's an exchange, right? And welcoming people to say, this is why we don't trust that exchange, and also articulate what it would take and what it would have to be to trust that. And, like Brandon's saying, showing that you heard that. I heard you. And changing, it's a relationship, If your partner tells you, you always leave the lights on, and so XYZ, and you say, I'm sorry, you can trust me to handle it, and then you keep leaving the lights on, you're proving the point. So you have to, inviting people to say, yeah, acknowledging that truth, and then saying what it would take for repair, what it would take for healing, what it would take for a relationship to look different, and then just doing it, like seeing being trustworthy as a necessary requisite to even have the privilege to do this work with community, I think is like the right stance.
Brody, anything you'd add there? I think you might be on mute.
I would say get the community members to be part of the survey. Basically, let them change roles, and they can, because it's easier for somebody, let's say a community resident, to be part of the panel discussion or the conversation when they know what it looks like from their side versus the regulator that's on the outside looking in. So have them change roles. Same thing, like, again, I'm a banker. I think it makes a world of difference when you're in a majority minority area, having somebody that looks like them. The community has told us that the reason we don't mess with you is because you don't mess with us. And if we're not hiring minorities, then there, again, is that distrust. So I think people should change roles and try to be more empathetic about, each other, and try to, get a better understanding.
Yeah, definitely empathy would go a long way with partnership building. I agree with that. So we have one last question. So how can we simplify the collection and synthesis process without sacrificing the authenticity of the data and community voice? So Vidette, maybe we could start with you and others can chime in.
Yeah, I definitely invite Brandon and Brody to share your expertise on this. I think thinking about working in community settings in CDCs, not to put simple and useful on like a binary, right? Like to think about asking the question that is most imperative to move community forward in whatever they're trying to achieve, and finding the most uh, kind of interpretable and simple way to gather that information. A lot of times it gets complex because we're trying to adopt frames and measures and tools that we see. You know, we're in a best practice world. We Google a thing, this community did it this way. They worked with the University of Nebraska to do it. They had a professor and a this and a this, and you download the toolkit, and then, you know, you set up the survey, and then it's like, I don't even know how to interpret this on the back end. When what you really needed to know was X, you know? So really just thinking about like, why am I asking this question? What is the question I need to ask? How will the answer to that question enable community to get what it needs? What's the most meaningful way I could get that answer? And then like trying to collect that. I think having been the person who is like, I work at a CDC, you know, half of my desk is being held up by books. I got one laptop and I got clipboards. You know, I understand, you know, being faced with that. You've got like a county indicators board, and you got all these surveys, and you got census data, and it's you, and you don't have any subscriptions to any of the data platforms or anything. So I would just say, like, having a useful answer that gets you results, like Brandon was saying, is like way more impactful than having the thing that can be compared to the university published study. So I think when I think about simplifying, I think about it from that lens of like, if I'm the one doing the job, how can I still get the job done but not overburning my capacity? And that's what I would say. I would love Brandon, Brody. What do you all think?
I think part of simplifying it is knowing who your audience is. Like, if you are trying to get answers from, I'm just speaking from my own experience with my organization, if your audience is all over 50 and over, they're not going to want to try to do a survey on their phone. They're probably going to want to talk. They probably just want to come to the building, sit down for coffee, and then just talk to them. And you'll probably get more insight just talking to them and getting their experience than you would ever get from a 10-question survey. 10-question surveys have their uses, but you always got to think about, is that 10-question survey going to the right audience? So I would just say, just be aware of who your target audience is when it comes to getting this data and finding the best method for collecting that data from them.
A great point. Brody, anything to add?
Only to echo what my panelists have shared. I don't have anything more to add. I think they killed it.
That's great. Well, great. Well, definitely from evaluations I've done, figuring out ways to simplify and really hone in, as our panelists were saying, on what you actually want to capture and make that meaningful is really important. So I think, unfortunately, we could not get to everyone's questions. And we really appreciate everyone submitting questions for the panelists. It makes the dialogue much richer, as you can tell. And just before we close, I would like to ask each panelist if there's any closing remarks or a key takeaway that you'd like to leave our viewers with today. Let's start with Brody.
I would encourage our group to just continue to network and work together in harmony. We all have a common goal, and I think it's for our communities to be better. So I'll just leave that piece that, just to be more understanding, more forgiving, and just try to work more closely to understand one another better.
Yeah, going back kind of to that empathy. Brandon?
I would just emphasize, as everybody moves forward with their organizations, that the foundation of all of our organizations is trust. We're all trying to implement change in our communities and trying to make things happen, but nothing can happen, at all if we do not have the trust of the people that we're trying to work with. So I would greatly emphasize that. Build that trust, and that foundation of trust will work leaps and bounds towards what you're trying to achieve.
Yeah, trust and empathy, very human. Yeah. And with that, we'll get over to you.
think continuing on the human thread, like the most experiential, impactful data work I've ever done has been around the organizing that it took to do that work, right? So like the relationships piece, build the relationships, if you're not working with residents, work with residents. That's the untapped potential that you did not know you needed. They're not bound by our training, by our processes, by our approval forms. They will see the way forward that we cannot see, So continue to organize, build those relationships, and really bring residents right into the center of it, and it will just unlock new possibilities.
That's great. Really take that community-centered approach that we've been talking about. Well, I want to thank the panelists extremely for your insights, expertise, and experience. This has been a lovely conversation with all of you. Thank you so much. And now I'm just going to turn it over to Juan. If you've missed any portion of today's discussion, we'll soon post the entire conversation on Build Healthy Places Network's website. And on that website, you can find other network common webinar recordings in case you want to check out a different topic. And we'll also inserting that in chat. We also have a new crosswalk essay that we want to just quickly mention. It's an article that explores how Native leaders are working collaboratively with tribal citizens and cross-sector partners to spearhead efforts that address multiple social determinants of health while bolstering tribal self-determination. You can check out that crosswalk too. And lastly, we have a new framework called the Repair Framework for Racial Healing, and it lifts up racial healing. That's an actionable approach to shift power and center community vision that we've been talking about. And it's part of co-developed with the Community Innovations for Racial Equity cohort members. So thank you, Brody and Brandon, for your input there as well. And finally, if you're interested in learning more about cross-sector collaboration and would like to attend future events like this one, please sign up for our newsletter that we call The Pulse to find out more information and to stay tuned. And we do have a post-webinar survey. We would love to hear from you of what you thought of this webinar and any thoughts on other topics that we should explore. So thank you again very much for joining us. See you all next time. Thank you.